Hello. This is a poster survey looking at how clinicians consent surgical patients for blood transfusions pre and post-operatively, and this aligned with the consent provided by national standards. The hospital I worked at is a tertiary referral centre where specialist surgery included cardiac, HPB, and complex gynecological surgery. With these kind of surgery, there is a lot of blood product requirements. And so I was interested to know how we consent our patients for blood products or if we consented at all. I compared these to the National Institute for Health and Care Excellence, which is nice, and the Joint UK Blood Transfusion and Tissue Transplantation Services. They both have advice and guidelines on verbal and written information which should be provided to patients when consenting them for blood transfusions. This can be seen from the poster where I've included some of the guidelines by the patient blood management. In terms of the methods of how I went around looking at this survey, I created 9 specific questions, looking at the person who was asking the consenting, when they were consented, how they were consented, and if any alternative blood transfusions were opted for, as usually these patients would be elective surgery. I then looked at the risks which were associated with the blood transfusions and whether these were also consented for. Of the results, we obtained about 55 responses from a mix of surgeons, intensivists and anaesthetists, with an overwhelming report being from the consultants. As being a tertiary hospital, the surgeries are usually consultant-led. The results showed that only 18% of clinicians did not routinely consent for blood transfusions, and of those who did, only 15% would offer alternatives. This can be seen from the slide here, where as I mentioned, 18% didn't, and how the consent would be gained. There was an overwhelming majority where verbal consent was gained and taken as the way forward. We then looked at which risks of blood transfusion were being consented for, and as can be seen here, you'd have acute, common and long-term complications. And it seems that of these, 52% were not applicable, i.e. that none of these complications were discussed with the patients at all, but simply the patients were asked, would you be happy to have a blood transfusion? Looking back at the original poster, this is obviously a multifaceted explanation for risks, and documentation is very important. We would need to be able to consent our patients and ensure that they understand the procedures they are having and the blood transfusions that they may require and the risks associated with them. We were able to close the loop and reperform this audit after implementation of education, and this showed excellent response. Thank you.